Hello, we are researchers from the U21 Autism Research Network, and we're here in this video to share with you some insights that we've gained about autism acceptance, camouflaging and mental health difficulties in our recently published study.
So firstly, what is the U21 Autism Research Network and who takes part in this research?
We are a network of autism researchers across the globe working together to ensure that our research is more inclusive of a global autism community.
Can you first tell me about the aims of this registered report and explain why you wanted to achieve these aims?
Of course. So this study had two primary aims, and the first of these was to replicate previously reported relationships between autism acceptance, camouflaging and mental health difficulties in a more diverse cross-cultural sample of autistic adults. And this was also motivated by the fact that all of these previous studies have solely examined relationships within the UK and the USA.
Secondly, we aim to compare levels of autism acceptance, camouflaging and mental health difficulties across cultures. This was motivated by a few different factors. For example, previous studies had identified cross-cultural variation in levels of acceptance towards autistic people by surveying non-autistic individuals. Here we wanted to compare levels of both external and personal acceptance from the perspective of autistic individuals themselves.
We also wanted to, for the first time, compare levels of camouflaging across cultures. We believe that this cross-cultural approach has great utility for understanding the mechanisms behind camouflaging, as the social environments to which autistic adults aim to adapt do vary across cultures.
Finally, by exploring acceptance, camouflaging and mental health difficulties across cultures, we hope to identify priority regions for anti-stigma interventions and highlight areas where greater support for mental health difficulties is needed.
That's great. Now can you tell us about how you fulfilled these two aims?
Yes, so before conducting our study, we consulted members of the autism community to ensure that our aims were in line with their research priorities, which they were, and also so we could get some feedback.
And after making some changes on the basis of their feedback, we recruited 306 autistic adults from 8 countries across the globe. These included Australia, Belgium, Canada, Japan, New Zealand, South Africa, the United Kingdom and the United States of America. These participants completed several validated questionnaires designed to measure personal and external acceptance, camouflaging and mental health difficulties.
Great, and what did you find?
So firstly, in terms of general levels of acceptance, we found that 3/4 of the participants did not feel accepted or only sometimes felt accepted as an autistic person, underscoring the pressing need to improve awareness about and reduce stigma towards autism.
Now regarding our first aim, in line with previous results, we identified that camouflaging one's autistic traits was associated with higher levels of depression and anxiety. In addition, replicating previous findings, we identified that experiencing a lack of external and personal acceptance was linked to higher levels of depression. However, in contrast to previous findings, we identified that experiencing a lack of external acceptance was not associated with stress or camouflaging. And we give some potential explanations for why we did not replicate these findings in our manuscript, so go check that out.
In terms of our second aim, we found significant differences across countries in external acceptance, personal acceptance, and depression, anxiety and stress, even after controlling for relevant covariates. Specifically, autistic individuals in Japan experienced lower levels of external and personal acceptance, and those in Belgium experienced lower levels of external acceptance than at least one of the other countries.
Regarding mental health, we found unique profiles of difficulties across countries. Autistic individuals in South Africa experienced consistently the highest mental health burden, displaying elevated levels of depression, anxiety and stress, while those in the US experienced the lowest mental health burden. We think that this could be due to systemic barriers in accessing support in South Africa, which you can read more about in the manuscript.
Finally, levels of camouflaging also differed across countries, with Japanese participants scoring the lowest. However, this effect became non-significant after controlling for covariates.
That's a really fascinating set of results. Were there any other results that you found interesting?
Yes, so in this study we also investigated whether there were differences in levels of acceptance, camouflaging and mental health difficulties across genders. And interestingly, what we identified was that when compared to males and females, non-binary people reported lowest levels of acceptance and highest levels of camouflaging and stress, demonstrating the important role of intersectionality.
That's very interesting. And what do you think are some important implications of your findings?
Yeah, so here we demonstrate that experiencing a lack of acceptance and camouflaging one's autistic traits is linked to poorer mental health. So these findings underscore the crucial need to combat the stigma surrounding autism and to reduce the pressure on autistic individuals to conceal their identity. In addition, by identifying the most vulnerable regions, we've managed to locate priority areas for anti-stigma interventions and highlight areas where greater support for mental health difficulties is needed. We hope that by implementing these interventions, autistic individuals will be able to live happier and more fulfilled lives.